Hey everybody, it's the Mommy Penguin, and today I'm just going to tell you about a little overview of my week 13, and then I'm going to go and tell you everything that happened in week 14. And then yesterday I actually turned 15 weeks, so now I'm 15 weeks and 1 day. So week 13 we went on this huge trip where we did a lot of driving and flying, and I'll do a whole video on that and how that went. And it actually went really well, and because I went to a place that was kind of a little bit more delayed in the seasons, I just had a lot more energy, and we got to spend a lot of time with my sister and her children, so the cousins got to play a lot together, so that was really fun. And then week 14, I get back from the trip. I'm totally exhausted. Even my daughter is completely exhausted. She'd just fall asleep on the floor. She was just curl up with her little blanket and fall asleep on the floor. And tons of jet lag. And then I get into the week 14, and Monday comes, and I'm trying to make it do all this stuff for work because I'm trying to work 40 hours a week from home. And then I have my midwife appointment in the afternoon on Monday, and we have a little appointment, and then she goes to do the Doppler to find the heartbeat, and she's not finding it, so she decides to order an ultrasound. And I decide, well, this is our first ultrasound. I'm 14 weeks, and I wanted to call my husband to have him come. So he grabs up my daughter and comes to the appointment, and he's a little late, so we actually had most of the ultrasound done by the time he arrived. So what I found out was when we first went to do the ultrasound, I saw the baby immediately wave at me with 5 fingers and then kick me, and that just made me really feel great. I knew that the baby was safer, and I knew that the baby had all 5 fingers, and that just totally made me, excited. And then the ultrasound tech says, "Did you have uterine surgery?" And I'm like, "No." And she's like, "A DNC?" And I'm like, "I had a miscarriage in March, but they didn't do a DNC because everything, everything came out." And she's like, "Oh, well, there was a twin, but it only made it to 8 weeks." And I'm like, "There was a twin? Oh, okay." And then immediately my husband comes in right then, and I'm like, "Okay, so we have a healthy baby, but there was a twin." So then we're like, then all these questions start coming up, what's going to happen? What happens to an 8-week-old fetus? And she's like, "Oh, it'll be absorbed." I'm like, that sounds absorbed, and I shouldn't miscarry it, and everything should be fine with the healthy baby, the healthy fraternal, they were fraternal, right? Yes, they're fraternal, not identical. And she said that if they had been identical, then that would have put the baby at risk, but because they're fraternal, then that actually is safer for the remaining baby. And my husband was like, "Whoa," and just kind of a little shocked. And then, I was handling it really well in the doctor's office. And then when we went to, when I came home, I was just doing some more research. Everything still seemed fine with the baby. And that made me really happy, but I still kind of couldn't get over the fact that we might not have any remains of the first one to be able to bury, or, do, be able to have some closure with like we did. We actually were able to have a full memorial service and burial for the one that we lost at 5 weeks in March, and we were able to name it. And my husband had this dream about a baby named Peach, and I wasn't sure if, well, what if that's the remaining twin, or what if that was the one that was lost? Like, what should we name this? I don't want to leave a baby unnamed. So that's kind of all the things that we were able to kind of talk through, and we decided that the one that was lost, we'd name Peach. And my husband had this dream that was kind of surreal. He said it felt kind of like everything was just really perfect where it was. And this was right after we found out we were pregnant. So we found out we were pregnant at 4 weeks, and this baby we would have been carrying it still healthy for another 4 weeks after that. So I knew for 4 weeks that this baby, the twin that we lost, or vanishing twin is what they call them, because if we waited till 20 weeks, we technically wouldn't have even known. And that part was making my husband a little not as soft about this miscarriage, because he's like, well, technically women would have even known. So, like, he was definitely a lot more gentle with the first miscarriage, but this one, because we still have a viable baby and we can't handle twins at all, like, I don't know how I could survive with twins at this point, with our structure, with me working 40 hours from home and him trying to do full-time school. Having a new baby is, with a 20-month-old, is going to be hard enough, much less trying to both work 40 hours without any daycare, with 2 newborns and a 20-month-old might be a little bit more difficult. So that's another reason why he wasn't being as sympathetic, I think, because he was just like, I probably would be more shocked if we were having twins than if we were just having the one. So, okay. But he had this dream where they were a part of this like African village, and all these women were on swings and swinging their had their infants on swings, and they were all pushing and swinging their children, and our newborn was on this swing. And then he was told that the name of the baby was Peach because it's soft, gentle, and sweet. And he decided, like, he really strongly felt that that was the baby that we lost. And that ended up helping, like, me. So it'll be Peach. And our first miscarriage baby was Remember. So we have Remember and Peach that are in heaven now. And we also have this one on the way, and our other daughter, and who knows what we'll have, in the future. But finding out there was a vanishing twin, and knowing that, like, I don't have, like, the ultrasound tech didn't take, I went through my pictures and I didn't see the picture of the vanishing twin, and I was, like, I'm thinking about hurrying over to just a private ultrasound place and paying $69 and getting just some more pictures in the video. So I'll have video of this baby, and then we'll have the video of the vanishing, and then we'll have pictures and video of the vanishing twin, and at least I'll have some sort of thing to kind of remember the Peach by, and that will make me, I don't know why that makes me feel better, but it does. So anyway, we still have a healthy baby, one healthy baby, and it was just a large shock, and I think I'm doing a little bit better now, and I'll probably be putting in my birth plan that that I want to keep that portion of the placenta, like the sac, whatever we can have, because technically there will be remains in there. I want that kind of closed up so that we can have that buried. And that's just something that I feel like I want, versus just handing the remains of my child over to some medical staff. I just, like, when I know it can be buried and that's something that we can have done for, complimentary by the Catholic hospital, that makes me feel just a lot more like I respected my child the best that I could and did the best things that I could do for my child. And I know a lot of women don't even have that option. They don't have Catholic hospitals in their vicinity, or they were not told, or the medical staff was just so rude to them. My sister had to fight to have her child back, and then had to keep it until she was around a Catholic hospital and could bury it. So that is definitely something that, since I know about and it's offered, I want to be able to do that, to be able to respect my child. So that's kind of just super shocking news, but again, we're glad that there's still the healthy 14-week one that seems to have all their fingers and be able to kick and just look so big. And I can't believe that now, that was the size of a lemon, and now we're at 15 weeks in size of a small apple, and I'm just getting so excited again. It's like, wow, it's this big already. Because before, I think with my first, she just seemed to take so long to get to that point, and now we're just waiting. So super exciting news, and I'm half super excited and half just brokenhearted, and that's just kind of a strange place to be in right now. But I'm sure any mommies that have had kind of that same thing happen, you feel that kind of torn between heart, and maybe you didn't have as many options as I have, so I want to be able to take advantage of them as if I have them. And maybe if you have a Catholic hospital in your area, and you can tell other women that you find out, other mommies, that that's an option for them if they should have a miscarriage, because it is extremely common, between 15 and 25%, and with multiples it's up to 30%. So this is something I've really struggled with. Is it my fault? Because I feel like it should be. I feel like there should be an answer, and chromosomal deformities just doesn't feel, it doesn't feel like, okay, well great, what can I do with that? So I just keep having miscarriages because I don't know. It just frustrates me, because I like to have solutions and answers and solid, concrete, can put this away. There's answers, and I can do this and this and this to change. That would make me feel better if it were my fault, because I could change it so it would stop happening in the future. But everything that I've read really have been, when they actually did the tests and they ran, all the autopsies and stuff, it has been chromosomal deformities or abnormalities, and in up to 70% of the children that were miscarried. And then in the other percentage rate, you have, I think, hormone levels being off, which I think that because the other twin was okay, and the fact that it grew to up to 8 weeks, I would think that the placenta was implanted correctly. So, or it's both of the cords must have implanted correctly for it to grow. And if I had hormonal imbalances, that would have hurt both babies. So I'm thinking that it must have been just a chromosomal abnormality in the one, which does make me feel a little bit better now that I've done a little bit more research, knowing that the top 3 reasons are the chromosomal abnormalities, sorry, my daughter's crying, I need to go get her, but the misplanting of the placenta, and the other one that I mentioned where hormone imbalances with progesterone. And then there's also two more that are the mommy's fault, more so, and that's having over 200 milliliters of caffeine, and I only have 1 cup of just like tea, like a black tea a day. So like Lady Grey tea is what I have every morning, and that's a third of what you'd get in a same size of coffee. So it's like less than 1,000 milliliters of caffeine that I have. And sometimes I wasn't even drinking that. I was just drinking the pregnancy tea, and I was trying to drink a lot of the pregnancy tea, especially in those early times. And I was also, and that was before I started any of my medications. So I hadn't started at the 8-week point any of the medications, but I did have a cold. I don't know if that would have, like, if it hurt one, wouldn't it have hurt the other? So I don't know. And that was not listed, like, that type of, like, little cold probably wouldn't have been a big deal. And then there's also drug and alcohol use. And I don't even like alcohol and have never even touched drugs, so I know it's not those. So, and again, I hadn't even started the Zofran at that point. And I was trying to keep up with my vitamins, but I was having pretty bad morning sickness that last 2 weeks. So maybe I wasn't doing that, but I was trying to keep up with the pregnancy tea and had tons of protein and was trying to do everything I could to stay healthy. So those kind of things made me feel better that it probably was a chromosomal abnormality, and at least I can kind of cross the other ones off the list to have some sort of conclusive evidence, because that's something that I need. And thanks for listening through this, and have a great 14 weeks.